I'm going to wash my hands. I'm Jordan. I'm going to be your nurse doing the head to toe assessment on you today. Is there any questions you have before we start? No? Okay. All right. Well, first I'm going to start off by checking your height and weight, okay? So if you would stand up for me, I'm going to get you to step on the scale real quick for me. Okay. All right, your weight's 128. All right, I'm going to check your see how tall you are. All right. 65.5 inches. The body mass index of 22.7, which is like the amount of body fat you have for your height and your weight. So I get you to sit on back up there for me. Okay. And next I'm going to check your vital signs. I'm going to check your temperature first. Put this under your tongue. Check your heart rate while we're waiting on that. Okay. Temperature is 97.6, heart rate 72. And then I'm going to check your blood pressure. And place this on your arm. Alright, your blood pressure is 118/78, and normal is 120/80, so that's within normal for you. Next, I'm just going to look at your skin. There's skin tone is even on bilateral upper extremities. Superficial veins noted. No lesions noted though. Skin tone all over is even. Hair and scalp is clean and dry. Hair is evenly distributed. Let's see. I'm going to look at your nails. Nails are flat and pink. Capillary refill is brisk on bilateral fingers. Next, I'm going to check the elasticity of your skin. I'm just going to check and see how thick your skin's elastic. Then I'm going to check your head. Let's see, your head is symmetrical. His eyes, nose, lips and ears are symmetrical bilaterally. Skin is warm and dry, free from any odor. Their movement of his eyes are smooth. I'm gonna, let's see, my stethoscope. I'm gonna palpate your temporal arteries. Temporal artery on both sides is smooth. Now I'm gonna listen to it with your with the bell of the stethoscope. No bruit noted. So no bruise noted on bilateral temporal arteries. Okay, so next I'm gonna check for TMJ. So what I'm gonna do is I'm gonna place my hands right behind your jaw, and I want you to open and close your mouth for me. So movement, smooth movement. There's no tenderness noted. Next, I'm going to palpate your trachea. So what I'm going to get you to do is to slightly turn your head. Okay, so trachea is midline. I'm going to feel for your lymph nodes now. So first one is the pre-auricular, right here. No lymphadenopathy noted. Post-auricular. No lymphadenopathy noted. Retropharyngeal. No lymphadenopathy noted. And then occipital. No lymphadenopathy noted. Submaxillary. No lymphadenopathy noted. Submental. No lymphadenopathy noted. Okay, and then your anterior clavicle chain. No lymphadenopathy noted. And posterior cervical chain. No lymphadenopathy noted. And supraclavicular. No lymphadenopathy noted. Alright, so next, I want you to move your head up and down for me. So up and then back down. Okay, and then side to side for me. Alright, and then this is just checking for the movement. So there's no limits of the movement and it's smooth. Next I'm going to check your eyes. If you could, can you stand up for me? I'm going to get you to walk over to in front of the desk. Let me give you a piece of paper. I'm going to get you to cover up your left eye for me, and we're going to check the vision in your right eye. So, are you able to read this line right here?
Probably not.
What about this one for me?
DFPOTEC.
Okay. Alright, so for the right eye, the vision is 20/20. Okay, now I'm going to get you to swap the piece of paper. I'm going to check the vision in your left eye. We'll start with, can you read this one?
See, LEF, OD, PCT.
Are you able to read this one?
No.
No, okay. Alright, so the vision for your left eye is 20/15. I'll get you to remove the paper. I'm going to check the vision, far vision for both of your eyes. So just let me know when you're ready. You ready? Okay. Are you able to read this one?
Yeah.
Can you read that for me?
LEF, OD, PCT.
Are you able to read this one?
FBP, LT, CEO.
This one?
Oh no.
Okay. So the vision for both of your eyes is 2013. So if I can, I'll get you to come sit back in the chair for me, and I'm going to check your near vision. And the near vision also will check your cranial nerve 2, which is your optic vision. Let's see. All right, I'm going to get you to do the same thing. I want you to cover your eye, your right eye, with a piece of paper, and I'll check the vision for your left eye. Okay. Are you able to read this one? Read that for me.
PTL FCZVEO.
What about this one?
ELZTCO FPD.
Are you able to read this one?
VZECLPTOF.
Okay. All right. So, are you able to read any further?
LOPF ZEDGT or DCT.
We're going to go with this one. Let's see. Your vision is 1424 in your left eye. So now I'm going to get you to cover up your left eye, and we're going to check the vision for your right eye. Can you read this one? This one?
Yeah. ELZTCO FPD.
Okay. What about the next line down?
DZECLPTLF.
Okay. Are you able to read any more?
No.
Okay. All right. So the vision for your left or right eye is 1424. So now I'm going to get you. I'll take the paper from you, and I'll get you to read the line. Which line you're able to read with both eyes open?
LOP FCEDGT.
Okay, so for both of your eyes, your vision, near vision, is 1420. So that means your cranial nerve 2 is intact. So all right. So next, I'm going to check your 6 cardinal field to gaze. So what I'm going to get you to do is look at my pen light, and I'm going to move the pen light, and I want you to move your eyes with it, okay? And this is just going to check the muscles in your eye. You ready?
Mm-hmm.
Okay. Okay. That also checks your cranial nerves 3, 4, and 6. Your ocular motor is cranial nerve 3. Cranial nerve 4 is trochlear, and cranial nerve 6 is abducens. And the cranial nerve 3, 4, and 6 are intact, and no nystagmus is noted. All right, the next I'm going to do is I'll give you a piece of paper, and I want you to put that over your left eye. And I'm going to put this over my left eye, and I'm going to check your peripheral vision. So as soon as you see the pen light with your right eye, I want you to tell me, okay? Ready?
I can already see it right away.
All right, well then, we'll switch eyes.
Okay.
So peripheral vision is intact. Let's see, I'll get you to alright, the next one I'm gonna check the corneal light reflex. I'm gonna you just look straight forward. And I'm gonna check. And that's checking your cornea. Alright. And then I'm going to bring in, I'm going to get you to look straight at the pen, and I want you to then look to the side, and then look back to the pen, and look to the other side of the pen. Okay. All right, so pupils are equal, round, and reactive to light and accommodation. And next, I'm going to check your ears. So I'm going to just look at each ear. No pain with me. Okay. I'm going to look at the tragus and the auricles. The ears are symmetrical bilaterally. There's no edema or redness noted, no lesion. Patient has no piercing. Then next I'm going to check your sinuses. I'm going to check your maxillary sinus first. Any tenderness. Okay. And then the frontal sinuses. Okay. The sinuses are non-tender. The nose is symmetrical. Both nares are symmetrical. Can you smile for me? Okay. The teeth, they're white and they're smooth. No debris noted. Can you open your mouth for me? No dentures, and no caps on the teeth. I'm gonna. Okay. All right. Now I'm gonna check. I'm gonna get you to stick your tongue out for me. I'm gonna check your tongue. Can you move it to the side for me? Yep, and the other side. Okay. All right. Stick your tongue out for me. Say ah. Okay. The uvula is midline. There's no redness or inflammation noted. No lesions. Uvula is the posterior pharynx, and the tonsils don't have any inflammation. Okay. And now I'm gonna check your. I'm gonna look at your chest first. There's the anterior thorax is symmetrical, and the size is normal for the patient. Can you do that for me a little bit? Okay. The posterior thorax is symmetrical and right size for the patient. No lesions are noted. Respirations are 16. His respirations are even and unlabored. I'm gonna listen to your lungs real quick. Okay, and I'm gonna get you to breathe in and out of your mouth while I'm checking your listening to your lungs. Okay. All right. You can breathe in and out of your mouth for me. Anterior breath sounds are clear bilaterally. Chest rise and fall are symmetrical. I'm gonna check your. If you can lean up for me and just kind of turn to the side. Other side. Thank you. Okay, I'm gonna do the same thing. You just breathe in and out of your mouth for me. Okay. Posterior breath sounds are clear bilaterally. Okay. Next, I'm going to get you to lay down for me. Stay right here for me. Okay. Next, I'm going to do a breast exam on you. And men are at risk for developing breast cancer just as well as women. So what I'm going to do is I'm going to perform the breast assessment on you, and then I want you to return demonstration for me, okay? So this is what you're going to do. You're going to palpate for and feel for or touch for any, lesions or tenderness that you may feel, okay? So you'll just take your fingers and touch around. In a circular motion. Breast is flat, no lesions are noted, there's no tenderness noted. And I'll do the same on the other side. Breasts are flat, no lesions are noted, no tenderness is noted. And then you're going to compress the nipple just to make sure there's no discharge, which there's no discharge noted bilaterally. And then you're also I'm going to check up under your arm, the lymph nodes up under. Okay. No lymphadenopathy noted. I'm going to check your up under your other one. Okay. No lymphadenopathy noted under bilateral axilla. Okay, now I'm going to get you to return the demonstration. So this is what you just take your hand and palpate just like I did in a circular motion. Just use your two fingers to palpate. And you're going to start and go around in a circle to the nipple, okay? And I'm going to get you to try with the other side. And what are you looking for?
That's long.
And any tenderness that there may be. Okay. All right. You have any questions about that? Okay. All right. Next, I'm gonna I'll check your carotid artery, and I'm gonna look at the jugular vein. So if I could get you to turn that way for me. There's no jugular vein distension. I'm going to palpate the carotid artery. Okay. Heart rate 78. And I'm going to get you to turn and look towards me. No jugular vein distension noted. I'm going to check the carotid artery on this side. Okay. Pulse 78. The 2 plus pulses bilaterally, carotid artery. Now I'm going to listen with the bell of my stethoscope to listen for any increase in blood flow in your carotid arteries. So I'm going to listen to this side. I'm going to get you to hold your breath, okay, while I listen. So whenever I tell you, just hold your breath for me. All right. You can hold your breath. Okay, you can take a breath now. All right, I'm going to do that on the other side too. So whenever I tell you, I'll just get you to hold your breath. Okay, hold your breath for me. Okay, no carotid breathe noted bilaterally. Okay, next I'm going to feel for the different landmarks of for your heart. So the first one is going to be your aorta, and that's going to be in the right sternal border. In the second intercostal space. Okay, and then the next one, and no pulsations are noted. The pulmonic, which will be the left sternal border, second intercostal space. No pulsations are noted. And then the Erb's point, which is the left sternal border, third intercostal space. No pulsations noted. Then the tricuspid, which is the left sternal border, fifth intercostal space. No pulsations noted. And then the mitral, which is the apex on the left or fifth intercostal space. And there's pulsations noted there. Okay, next I'm going to listen to your heart. I'll first listen with the diaphragm of my stethoscope. I'm going to listen to the aorta, which is the right sternal border, second intercostal space. S1 and S2 noted. I'm going to listen to the pulmonic, which is the right sternal border, left intercostal space. S1 and S2 heart sounds noted. Okay, the next one's going to be the Erb's point, and that's the left sternal border, third intercostal space. S1 and S2 heart sounds noted. And I'm going to listen to the tricuspid, and that's the left intercostal space, or left sternal border, fourth intercostal space. S1 and S2 sounds are noted. And then the mitral, which is the apex in the fifth intercostal space. And S1 and S2 heart sounds are noted. Okay, next I'm going to listen to the same areas with the bell of the stethoscope, and that's going to let me know if there's any heart murmurs or any extra heart sounds. So now listen to the aorta. No murmurs or extra heart sounds noted. Pulmonic. No murmurs or extra heart sounds noted. Erb's point. No murmurs or extra heart sounds noted. And then the tricuspid. No murmurs or extra heart sounds noted. And the mitral valve. No murmurs or extra heart sounds noted. Okay, next I'm just going to assess your pulses. The first one I'm going to assess is your radial pulse. Radial pulse +2 noted bilaterally. Okay, the next one will be your brachial. Pulse rate is 80 bilaterally. They're regular +2 noted. And then I'm going to check your carotid. I'm going to check your popliteal. I can get you to. I got it. Popliteal pulse palpated, regular. And I'm going to feel for the posterior tibial. Pulse rate 82. Bilateral posterior tibial pulses regular +2. I'm going to check the dorsalis pedis. Dorsalis pedis pulses regular and bilaterally and +2. Okay. Next, I'm going to listen to your abdomen. Let me check. I'm going to check your lower extremities, both your legs, for any swelling edema. No edema noted on bilateral lower extremity. Now I'm going to listen to your stomach. I'm going to auscultate the abdomen, starting with the right lower quadrant. I'm going to listen for bowel sounds. Active bowel sounds noted, right lower quadrant. I'm going to listen to the left lower quadrant. Active vowel sounds noted in left lower quadrant. I'm going to listen to the left upper quadrant. Active vowel sounds noted in left upper quadrant. I'm going to listen to the right upper quadrant. Active vowel sounds noted in right upper quadrant. So positive or active vowel sounds in all four quadrants. Next, I'm going to listen to for any vascular bruits. So I'll put my stethoscope on your stomach again with the diaphragm. Listen to the aortic. No aortic vascular bruit noted. So now I'm going to listen to for renal bruit, which is in the upper quadrant. No bruits noted for the bilateral renal. And I'm going to listen to the iliac. No iliac bruits noted bilaterally. Okay, next I'm going to check for your muscle tone and strength. So I'm going to get you to push against my arms. So if I can get you to put your arms up, I can get you to push against them. Okay, and then put your arms the other way. I'm going to get you to push up again. Okay, and then down against them. Okay. Alright. Muscular strength is equal and strong for bilateral arms. Next, I'm going to get you to grasp and squeeze as hard as you can my fingers with both your hands. Okay, bilateral hand grasp are equal and strong. Next, I'm going to get you to push against my hand. Okay, and then pull up against my hand. Okay. Bilateral feet and ankles are muscle tone are equal and strong. Next, I'm going to get you to stand up, if you can. And stand right here for me and turn around. I'm going to get you, what you'll do is I'm going to get you to put your arms out and you'll close your eyes and touch your finger to your nose. And this is called finger to nose test, and it's going to check your balance and coordination. So if you can, I'll get you to close your eyes and touch your left finger to your nose. Okay, and then your right finger to your nose. Okay, patient was able to perform this test correctly to display his balance and coordination. Let's see. Next, I'll get you to sit up in the chair because I'm going to assess the rest of your cranial nerve. So, cranial nerve 1, which is the olfactory nerve, that is going to assess your smell, sense of smell. So, I'll get you to close your eyes, and I'm going to get you to close one of your nares, the nose. Okay. Alright, now I'm going to get you to identify the smell for me, okay? Can you tell me what that is?
Peppermint.
Okay. Alright, and then close the other one. Okay.
Same thing.
Okay. Alright, so your cranial nerve 1, the olfactory nerve, is intact. Next, we've already checked the cranial nerve 2, 3, 4, and 6. I'll get cranial nerve 5, your trigeminal nerve, and that's going to just check the senses of your face. So what I'm going to get you to do is close your eyes, and I'm going to rub your face with this cotton, and you just let me know when you feel me touch your face with the cotton. Okay, you ready?
Mm-hmm. Yeah.
Okay. All right, so cranial nerve 5 is intact. Cranial 7 is going to be your facial nerve. And that's going to let me know test the muscles in your face. So what I'll get you to do is raise your eyebrows, okay, and then smile for me. Okay, so cranial nerve 7, the facial nerve is intact. Cranial nerve 9, which is the glossopharyngeal nerve, and that I've already tested that whenever I did the popsicle stick and got you to say ah. So your uvula is midline. The cranial nerve 9 is intact. Cranial nerve 10 is also tested, which is your vagus nerve. And I'm going to get you to take a sip of this water and swallow for me. Okay, you swallow. Okay. The trachea is midline, superior movement. So cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus nerve are both intact. No deficiencies noted on either one of those. Cranial nerve 11 is your accessory. Test the accessory muscles, the sternocleidomastoid muscle in your shoulders and your your trapezius muscle. So what I'm going to get you to do is I'm going to get you to shrug your shoulders for me. Okay. All right. Now I'm going to place some resistance against you. So I'm going to put my arms on you, and I'm going to get you to shrug against my arms. You ready? Okay. Then the next one, I'm going to get you to turn your head to the left, turn your head to the right. Okay. Now I'm going to get you to turn your head against resistance. Okay, great. So your cranial nerve 11, the accessory nerve, is intact and no deficiencies are noted. Cranial nerve 12 is going to be your hypoglossal nerve. And that's going to test the movement of your tongue. So check the muscles in your tongue or the nerves in your tongue. So if you stick your tongue out for me. All right, and then move it to the left and right. Okay, great. Okay, next I'm going to put my hand against your cheek, and I'm going to get you to touch your left side of your cheek. Okay, all right, and then the right. Okay, great. So the cranial nerve 12, the hypoglossal nerve, is intact. There's no deficiencies noted. And then the next thing we'll do is I'll check your reflexes. Okay. So what I'm going to do is I'm going to use this instrument to check the reflexes. The first one I'll check is your bicep. Okay, so I'll get you to relax your arm for me, okay? And I'm going to okay. So bicep contraction was noted. 2+ reflex for the left bicep. Right bicep. Sorry, right bicep. Okay, I'll check the left bicep. Okay. Bicep contraction was noted. 2+ reflexes for the left bicep. The next one I'll check is your tricep. Okay, so I'm gonna hold your arm. All right, and just relax it. Okay. The right tricep contraction noted. 2+ for reflexes. I'm going to check your left tricep. Just relax your arm. Okay. Left tricep contraction noted. 2+ reflexes. Next, I'm going to check the patellar. And that's gonna let me know the reflexes. I'm just gonna gently tap your knee right here. All right, left patellar contraction noted, 2 plus reflexes. I'm gonna check the right one. Okay. Right patellar contraction noted, 2 plus reflexes. All right. Do you have any questions about anything? Okay. Well, thank you very much. I hope that you have benefited.